What are Mounjaro or Ozempic babies? I'm Professor Frank Joseph, consultant endocrinologist and founder of Dr. Frank's Weight Loss Clinic. Many women who have previously not been able to conceive because of irregular periods linked to their living with overweight or obesity now find themselves caught out and accidentally getting pregnant following significant weight loss with treatments with Wegovy and Mounjaro. Babies that are born accidentally in this scenario have, in popular terms, been termed as Ozempic or Mounjaro babies. A scientific review that was published in January 2025 in the American Journal of Obstetrics and Gynecology studied retrospectively, so looking backwards, over 900 babies that were born to women with type 2 diabetes who were on treatment with a GLP-1 agonist at the time of conception. Obviously, GLP-1 stopped as soon as the pregnancy was confirmed. But the good news was, to some extent, that there was no suggestion of an increased or significantly increased risk of congenital abnormalities in the babies born to these women. Now, the study didn't really comment on how good or bad their diabetes control was, and we know that that affects babies as well. And the other thing that it didn't talk about was whether there was an effect on the baby's growth and development in terms of size and maturity, but also there are potentially other side effects that weren't looked at, and also there wasn't enough data on the loss of babies before they delivered if they'd been exposed to GLP-1 agonist therapy. But the message still remains the same. If you're a woman on treatment with Mounjaro or Wegovy, make sure that you are using effective contraception. You don't want to be in a position where you're worrying about what might or might not happen to your baby. This is a really emotive topic, and hopefully my message is clear and it will allow people to enjoy their weight loss journey to getting healthier without the stress of thinking about some of these other consequences that can happen. So be safe.